Hi everyone, my name is Boissonneault. I'm a first-year NHRC resident at the Timmins site. Today I will be discussing an article called "A Pan-Canadian Narrative Review on the Protocols for COVID-19 and Canadian Emergency Departments." This article was written by myself as well as NHRC medical student Sebastian Diebel. We have no conflicts of interest to declare. On March 11, 2020, the World Health Organization declared the novel coronavirus disease 2019 a global health pandemic. The Canadian healthcare system hypothesized that patients with suspected COVID-19 or worsening symptoms would present to the emergency departments. Therefore, it was imperative that these departments have protocols in place to safely triage and assess these patients. A narrative review regarding Canadian emergency departments was thought to be important to highlight and summarize the measures that were taken in Canada. Additionally, if another pandemic occurs, the strategies utilized that were brought forward in this narrative review may be beneficial, similarly to how the SARS pandemic strategies are being applied to the current COVID-19 pandemic. Our methods included literature search using PubMed and Google Scholar. A total of 142 articles were found and screened, ultimately yielding 19 articles following this screening. The scale for quality assessment of narrative review articles, also known as SANDRA instrument, was adhered to. In our discussion, we reviewed strategies that were implemented widely across Canada to enhance patient safety and decrease exposure to the COVID-19 virus. These strategies included virtual care implementations using various online platforms, simulation training in emergency departments, patient screening upon presentation to the emergency departments, personal protective equipment and precautions, as well as rural context and the disparities of living in rural towns. Specific limitations of this narrative review are to consider that during the writing of this article, the COVID-19 global pandemic was ongoing. Therefore, once studies evaluate the interventions that were discussed, it may be ideal to complete a follow-up or additional narrative review. In conclusions, the protocols designed and utilized by various Canadian emergency departments are important to document and analyze, despite not yet knowing the full scope of their effectiveness, as they could be the foundation for future research and could be beneficial if a similar situation manifested in the future. Thank you for your time.